So what we're going to go through now is advanced PPE, and here's my glamorous assistant Megan. There's going to be two separate types of PPE that you will be wearing, an advanced PPE which will include the long gown, and a basic PPE which is just the pinny and a mask. Different areas will require different sets of PPE. So an advanced PPE is probably in those high risk critical areas such as critical care, the emergency department, and in some COVID areas. The majority of places that you'll be visiting will be a more basic PPE, which we're going to go through as well. The most important thing to remember is that we need to be quite pragmatic about our approach to PPE, and when you're entering a ward, wherever that may be, just check with the nursing team to see what they wear and what they expect you to wear as well. So we're going to go through the advanced PPE to begin with. Now, wherever you may be that's doing the advanced PPE, there will be a checklist available at the place that you are donning. There may be people around to support you as well, but don't worry about it. Don't get too caught up in the sort of finer details of it all, because there will be people that can support you when you're doing this. Right, so first of all, you remove all unnecessary bleeps, lanyards, phones out of your pockets. You don't need to take these into any of the COVID areas. And then the next step is buddy to read each set out loud. Now, if you're going with a buddy, it's great, but if not, don't worry, because you can read the checklist as you go along. At this point, you gel your hands, apply your inner gloves. The next step will be to apply your long sleeve gown. Now, in some places they're plastic. You'll find in a lot of other critical care areas that they're actually they're onto the fabric gowns now. Some of them are reusable and some of them are being thrown away. So please pay attention to what that unit is doing with those gowns. But there will be plenty of people around that can guide you through it anyway. So tight at the back. Don't wrap it round and tight at the front. It makes it much more difficult when you're trying to get it off. Plus there's an increased risk of contamination. Then put your outer gloves on. So you need a second pair of gloves. These gowns are great because they've got thumb loops, so make sure your thumbs are through the loops, so when you're applying your second set of gloves, it'll make sure that the gown's tucked in. In other cases, when they don't have thumb loops, what we recommend is before you put your top layer of gloves in, apply a vertical set of strip tape across your hand here and the back of your hand here on both sides, and that will keep your gown in place when you apply your second pair of gloves. It'll also make taking it off a lot easier. So at this point, remove your glasses if you wear them, and you need to apply your mask. Place the mask on the front of the face, and then using top strap back first, and then bottom strap over. You're aiming for one above the ear and one below the ear. You do a fit check, and this is just to make sure that you've got the right fit for the mask. So take a long breath out, and you can feel round the sides if there's any air escaping other than outside of the valve. Then what you do is put your glasses back on so you can see. Now, depending on what you're going to be doing, will vary on what you're going to do for the next step. So in most cases, as research people, will be going in and reviewing patients. We're not going to be doing any aerosol generating procedures. So a pair of goggles is absolutely fine. However, if you were going to go in to do an aerosol generating procedure, you need to wear a visor. Also to remember, the availability of visors and goggles may vary depending on where you are. So if you've just got visors available, just wear a visor. For people who are wearing glasses, it's also a bit more comfortable. So the next step before you go into your COVID area is just have a buddy check. So there may be somebody around that can check, but if not, all you need to do is make sure that your gown's tucked into your top layer of gloves and there's no skin exposed, and that your gown is fitted properly around your shoulders and that it's tied securely at the back. Fab.